Good evening, everyone. I'm Safana, trainee pharmacist from CRU District General Hospital, Coronado. Compounding or reconstitution is a crucial part in pharmacy. It ensures the patient's drug stability. Compounded preparations are common for patients requiring limited dosage strength and patients with drug allergies, and home health care, and also for anti-cancer treatments, cytotoxic drugs. It is also known as antineoplastic drugs or anti-cancer drugs or chemotherapy drugs. We can understand that by seeing the symbol of the chemotherapy. The cytotoxic drugs means it includes wide range of chemical compound, and it has the ability to kill chemo cells, also treat cancer, but its action is not specific to tumor cells. It also acts on normal cells also, and also damage as a result of it. There is a lot of risk involving cytotoxic drug preparations, which produce significant side effect on patients or those who exposed. It is potentially mutagenic or oncogenic or teratogenic. It is critical for anyone who handle these drugs be adequately protected and use safety procedures. There are some routes of exposures. Inhalation of particles of or aerosols, or accidental ingestion, or self-inoculation by accidental needle or skin contact. There are some guidelines on handling cytotoxic drugs. Trained personnel should reconstitute cytotoxics. Reconstitution should be carried out in designated areas, which is clean rooms. Protective clothing, PPE, should be worn. Eyes should be protected. Means of first aid should be specified whenever an accident or something happens. And pregnant staff should not handle cytotoxic. Adequate care should be taken in the disposal of waste material, including syringes, containers, and absorbent materials. Cytotoxic drugs are teratogenic and all may cause life-threatening toxicity when they come directly in contact with the skin, eyes, or mucous membrane. The tissue ulceration and necrosis can be happen as a result. Administration should, where possible, be confined to those experienced in their use. Therefore, we have to reconstitute cytotoxic drugs in an isolator. What is pharmaceutical isolator? Pharmaceutical isolator is a clean air barrier that holds pharmaceutical and all associated materials inside while isolating them from the outside world. The equipment is designed with glow pods for workers to enter and exit at given interval, thus maintaining the health and safety of those who work with the equipment. Pharmaceutical isolators offer several ways to protect your product from contamination, and it also helps to create an environment where there is no hazardous contaminant from outside of the isolator. There are some types of isolators. Conventional is laminar flow and biological safety cabinets, which must be used in clean rooms, and more strict. It needs more strict environmental requirements. It happened to be class 7, but nowadays we have isolators, pressured isolators, which don't need clean rooms, and it happened to cause total physical separation from the product and the environmental, also more robust and immune to environmental disturbance. According to the pressure regime, we can divide isolators into three parts, which is positive pressure isolators. We can do work involving non-hazardous materials in positive pressure isolator, and the work zone and pass through under positive pressure. Sterility is even in the case of breach. And the next one will be, according to pressure, negative pressure recirculating isolator, which work involving hazardous material and anti-neoplastic or cytotoxic compound. The work zone and pass-through are under negative pressure, and the operator protection in case of breach, it also have optionally vented. Then there is negative pressure total exhaust isolators, which we can do works involving hazardous material that may volatilize, and the work zone and pass-through are under negative pressure. The operator protection in case of breach, it also has externally venting. We can now understand the parts of isolators. There are, it has a working surface. It is made by stainless steel, and also it has pass-through box and transfer hatches. It has two doors. One is external door and other one is internal doors. It also have two pairs of blows from the ports. It also has transfer hatches and sliding work surface. It makes easy to pull the things inside the working surface. It also has DEHS rapid test ports. It helps to test. And also it has the user-friendly practical keyboard. It is easy to on and off the machine during the usage. In our CRU, we have this model, which is GlowFast Cyto 264 Pharma, which means GlowFast Cyto Pharma machine. It has two boxes, 6 feet and 4 gloves. It also negative pressured isolator. It also have 14,644 ISO standard. GlowFast Cytopharma 264 stainless steel version. GlowFast Cytopharma cytotoxic isolators are negative pressure glow box devices. GlowFast Cytopharma is negative isolator in class 3 as per ISO, with leak type level measured in 16 Pascal per minute with real unidirectional airflow. The ISO 14,644 7 clean rooms and associated controlled environments. Part 7 means separative devices, clean air hoods, glow boxes, isolators, and mini environment. It also widely used in hospitals, pharmacies, and oncology clinics for compounding of chemotherapy agents or IV admixtures that can be harmful to pharmacy personnel. The H14 HEPA filters and ALPA filters are there to unidirectional airflow of better than class IOS3 air cleanliness conditions. The frontal window made by 12 mm safety glass, internal and external transfer hatch doors are made in transparent high resistant polyester resins. Now we can do how isolators work. It has working principles. The atmospheric air is pulled from the HEPA filters or ALPA filters inlet to position on top of the isolators and then pressurized downward toward the work surface prior to the HEPA filter by the main filters. The air is partially recirculated and partially exhausted via side transfer hatches before being washed again by virtue of double set of HEPA filters fitted inside the hatches. All the filters are low pressure drop certified filters. Transfer hatches are equipped with set of inlet and recirculating filters, while the body of the isolators is equipped with a full set of main and exhaust special bag filters for cytotoxic containment. It has high efficiency filters. The HEPA filters are 99.99 efficiency at 0.3 micron typical penetration, and also alpha filter has 99.999% efficiency at 0.1 to 0.3 microns the particle size. When the supply environmental air into the machine, it also pre-filtered and forward into the piston-like airflow, and that also filtered by alpha to exhaust air into the environment. It also some isolators have external venting. It helps to relieve some volatilizing agents to the external exhaust. There are some safe use of pharmacy isolators. Appropriate personal protective equipment and work practices should be maintained. And gloves and gown with knit cuff should be worn, and disposable gown made of non-linking and non-absorbable material, so that it can be absorbed hazardous materials, and also powder-free disposable chemotherapy gloves should be worn. The gloves should be cover the gown cuff, and gloves changed after every 30 to 60 minutes of continuous wear. And also respiratory mask is most suitable. Before the prescription preparation is made, we have to confirm the prescription is correct, and we have to check the validity of the prescription. First, we have to check the date and consultant signature and BHT or clinic number and patient name, and also ward or unit number and drug dose or and dosage forms and dilution, liquid and amount. We can also understand should understand way of administration, either by syringe or slow bolus injection, or by addition of cytotoxic agent directly into infusion fluid. Then we have to get the raw material ready. We are calling it making ready the tray. We have to choose the needle size and syringes. There are when we choose the syringes, there are various sizes: 3 millimeter, 5 millimeter, 10 millimeter, 20 milliliter, and 50 milliliter. Also, solvent or dilution liquid should be chosen. Either it should be normal saline or 5% dextrose, and also correctly selected and keep the correct chemotherapy drugs, and sterile wipes also should be there. And some things we have to do. We should not overcrowd the work zone. So then we can make it mix up. So avoid that doing. It is a compounding procedure. Also, we should Avoid working directly above the products, as it will block first air. We should also use alcohol pads to wipe the things, and also there are some things we have to do and don't when we preparing cytotoxic in isolators. We should wear appropriate personal protective equipment and handle small volumes inside the cabinet. Also remove contaminated waste according to local guidelines. Also switch on the cabinet before 15 minutes to start work. At the end of the day, work in surface, disinfect from top to down, periphery to center. Also, we should not do something, never use chlorine-based substances, for instance, sodium hypochlorite, which cause corrosion to steel and stainless steel, resulting in irreparable damage to isolator structure. Don't use ethanol as sterilizing substance. Don't eat, drink, or smoke in the work zone. Avoid substance that release explosive vapor. Don't work if airflow is not yet being activated. Also, don't close the inlet grid with the arm or tools. Avoid fast movement of your arms inside the cabinet. Don't work too close to the inlet grid area, and don't open the pass-through external door and internal hatch door at the same time. When we do follow these things, we prepare the chemotherapy. Once it finished, we have to recheck all the prescription and issue to the wards or unit in a safety method. Also, there is cleaning and disinfection procedure there for the isolator. Clean the outside of the aseptic isolator using a damp cloth soaked in soapy water or some other commonly available product for stainless steel surfaces. And also, we have to switch off the isolator and disconnect the feeding cable, and clean carefully all stainless steel surfaces using damp and squeeze cloth with soapy water or coolant product. Wipe all the surface using soft cloth, and also switch off isolator and disconnect the feeding cable. Protect your hands wearing gloves if required by the cleaning agent you are using. Put the cleaning agent on the side wall, the back wall, and the work surface in such a uniform way to avoid leaving not clean zones. Also, do not put the cleaning agent on the HEPA filters to avoid its damages. After preparation, we have syringes, IV bottles containing cytotoxic drugs should be labeled and dated. Additional label saying caution chemotherapy, disposal properly is recommended. And also contaminated needles and syringes, IV tubing, and alcohol pad should be disposed correctly because it causes hazardous environmental problems. And also hand should be washed between glove changes after glove removal, and waste should be disposed of according to Sri Lankan law requirement using spill kit. Also, the isolator need recertification is required when the isolator is relocated and isolator performance is suspended, or after filter or blow fan replacement at least once every 6 months. And at the end, I would like to say isolators are not magic boxes. It is only tool to prevent the contamination. So we have to use it more wisely and do our best to serve patients. Thank you.